problems are often associated with health harms. Infectious diseases such as HIV, AIDS, and hepatitis C have clear links to drug use. But there are also links between drug use and mental health problems that we need to consider. People with problematic forms of drug use often suffer from both a substance use and a mental health disorder. The coexistence of a substance use and a mental health disorder in the same person is usually called psychiatric comorbidity in substance users, or dual diagnosis. There aren't many figures on the extent of mental health disorders among drug users, but the numbers affected can be very high, up to 80% in certain groups of drug treatment patients. Depression is the most common mental health disorder associated with substance use, but anxiety is also often seen, and comorbid substance use disorders are more common in people with psychosis. Compared with people who have only a drug use or a mental health problem, people with comorbidity have more emergency admissions to general hospitals and to psychiatric hospitals, and more of them commit suicide. Substance use and mental health disorders are interlinked in different ways, which are sometimes overlapping. In some cases, a mental health disorder can be considered a risk factor for drug use, which may lead to the development of a substance use disorder. In other cases, drug use can trigger the development of a mental health disorder. Clinical practice has also shown that comorbid disorders often interact to make each other worse. It is often difficult to diagnose comorbidity among drug users. For example, in a person entering drug treatment, acute psychiatric symptoms might be attributed to their drug use, or the effects of withdrawal or intoxication from drugs may be misinterpreted as psychiatric illness. Patients need careful diagnosis and integrated treatment, where the two disorders are treated at the same time with professionals from both fields working together. Providing this level of care is a major challenge for policymakers, professionals, and clinicians.
Okay, Mike, let's talk.
Peace, Blake.
All right, good to see you again, once again. And that's not just talk, I mean that. So, question, should drugs be legalized?
I think if we're talking about drugs as the mental disease that it is, I think it should be legalized. I won't go that far. I will say I think it should definitely be decriminalized. Because it's the what is it? It's the stigma.
Yeah.
Of not only the drug but the drug
Again,
addict.
I'll say my core values have not changed. They will not change. I know what the truth is inside of me, and I don't hide that. I don't hide that. However, I don't really work directly with people that are, I'm not coaching people trying to get into recovery, so I'm sort of coaching the coaches now and training the trainers.
Okay.
Right? Yeah. So I'm able to express what I'm telling you here. And I don't necessarily have to say it's good that you're not shooting heroin today, you're just smoking weed and that kind of stuff. I don't really have to face that head on. And I know that's difficult because most of the recovery coaches out there are abstinent. There's a few I know that are on MAT and they're fantastic, by the way, like the few that I know. But most of them have an abstinence-based 12-step recovery program, and they have to show people how to safely inject crystal meth.
Wow.
And honestly, I can coach you to help coach people to do that, but I don't know if I could face that and be comfortable with that, right?
Yeah, the red tape, everything's public health funded, and that's where the struggle comes in because they want to see these evidence-based practices, and I'm a conspiracy theorist, and I think that all this research is funded, by motivation, and there's, the same pharmaceutical companies that make, the drugs that get people addicted in the first place are the same ones that are making these drugs to supposedly help people get better. So it's very frustrating. And